has been making significant progress towards eradicating HIV. Currently, 5 in every 100 adults in Kenya are living with HIV. Children are not spared either, especially those that fall through the cracks, missing out on the prevention of a mother-child transmission coverage. What more can be done, you may ask? Our medical correspondent, Dr. Mercy Korir, visited Uasin Gishu and West Pokot counties and reports on how having mentor mothers is aiding the fight against HIV. Take a look.
When the wheels of life bring you unexpected results, you have to find some balance. This is exactly what Rose Chelagat and Margaret Ochieng did. Two women, same age, two worlds, and a similar experience that inspired them to where they are.
Wengi wanafikiria negatively kunihusu.
Kitu cha kwanza ikakuja kwa akili yangu kwamba familia tayari mimi nimeshatupwa nje.
These two women are among the 5.2% of Kenyan women living with HIV. Like many women before them while pregnant, it is the routine antenatal clinic profile that made the diagnosis they did not expect.
Nilifika kwa kliniki saa 2 asubuhi, but nilitoka saa 12 jioni. So chenye kilifanyika hapa katikati si kuelewa.
Wakanipea dawa. Ndena mtoto naye akapewa. Mtoto alipatikana ni negative.
For Margaret, it wasn't such good news.
Wawili waliaga, but first born ako na last born nikapata 2010.
With a renewed resolve to be a mother again, Margaret adhered to her PMTCT, that is, Prevention of Mother-to-Child Transmission Protocol, and it worked. From their personal experiences, these two women qualify as mentor mothers, Rose in Uasin Gishu, Margaret in West Pokot.
Nikaona lazima nijitoe kusaidia wengine, sababu si rahisi.
Katika ile harakati ya kuwasanya mali pamoja, alafu tunakula pamoja, tunacheza pamoja, ninaonekana pia mimi ninameza dawa kama wao, so wanaona si wao peke yao wanatumia dawa.
Theirs is to undertake a journey with mothers, especially expectant mothers, in order to encourage them to adhere to their PMTCT protocol.
Tuwapende tu, tuwaonyeshe mwelekeo, kwa sababu hii dawa kumeza, ikiwa dawa ya malaria mtu anashindwa kumeza, amalisi dose, na hii ni ya maisha.
We have actually trained them on community PMTCT and even how they should go and counsel them and have them coming for clinics.
Rose Chelagat's desire was to be a counselor, but she never managed to study this due to financial hardships. But in a curious twist of fate, her living with HIV landed her her dream.
I advise watu wengine kwamba leo ukipatikana utakuwa wewe wa kwanza ama wa mwisho. Maisha bado itaendelea. As long as uanze dawa mapema. Tusingoje tu saa zile mwili imeanza kupungua, magonjwa zinaanza kuingia, then unakimbia uambiwe at that time.
According to the 2018 HIV Progress Report, Kenya had 69,497 pregnant women living with HIV. 3 out of every 4 of them were duly on PMTCT. Unfortunately, 8,000 children were newly infected with the virus, making that 7% of the people living with HIV, a worrying number that Rose, Margaret, and other community health volunteers are working tirelessly to bring to nil.
That's why you find that the HIV prevalence is high, because people are coming out to know their HIV status.
Rose swept the memories of her past behind her in order to be a mentor mother.
Na kwa wa kwanza kumwambia hata mimi sikuwa natarajia, lakini penye ilipatikana ni hivyo nilichikubali.
Their efforts have borne some fruits. The number of AIDS-related deaths among children has declined by more than 50%, from 10,200 in 2010 to 4,300. This is progress that can be sustained only if the previously low prevalence counties were not raising red flags by recording higher incidences.
We are worried because peace has come, everything has come, we should be very happy. Now we have a new threat, worse than the peace, worse than the conflicts that we had.
The Kenya AIDS Progress Report of 2018 may be a pointer to these ill effects if the rise in new cases in Uasin Gishu and West Pokot counties that have previously been considered to have low prevalence rates is anything to go by. Dr. Masi Korir, KTN News from Uasin Gishu County.